Hello, SYNGAP land. My name is Michael Graglia. This is episode 184 of the Cure SYNGAP1 podcast. I just did 183, but I'm stopping these things at 10 minutes now. So here we go. We're jumping into 184. Let's do this. The Developmental Synaptopathies Consortium is announced. Link is in the show notes. Click on that link and check it out. SRF shared Dr. Sahin's post. Dr. Sahin posted the official press release. What is the Developmental Synaptopathies Consortium? It is a part of the RDCRN. The what? The RDCRN is the Rare Disease Clinical Research Network. Clinical research meaning in humans, getting ready for clinical trials as opposed to scientific research, mice and cell lines and whatever. So if you go to the RDCRN link, and the RDCRN is part of NCATS, which is part of NIH, right? So just alphabet soup. But the NIH gives a lot of money. This is a flagship program for them of NCATS, the RDCRN, and then there's a lot of different consortiums. There's like the Brittle Bone Consortium and the this consortium and the that consortium and then the developmental synaptopathies. It's kind of heartbreaking to read that list of consortia because you realize how many terrible diseases there are out there. But our terrible disease is a developmental synaptopathy. And the Developmental Synaptopathies Consortium, like all RDCRN things, picks diseases that they expect to be in clinical trials soon and works on them with an established network of leading clinicians to help them do research. Now you're going to see a big number in that press release, $8-point-something million. You're like, ooh, we got 8 points. No, we didn't. That $8-point-something million is divided over 5 years, split between 4 diseases over multiple sites. So at the end of the day, everyone's getting a little bit of money. And that little bit of money is keeping clinics running. Because what I've learned funding Promise, our own natural history study, is clinical work is crazy expensive because you're paying for clinician time, you're paying for hospital time, you're paying for all the people who support the clinicians. It's bonkers. Punchline. Don't anchor on the 8 million, right? Just anchor on the fact that SYNGAP is now part of this machine. It's a 5-year grant. So for the next 5 years, and hopefully we will renew with the next cycle, and then it'll be a 10-year grant. But the point is, SYNGAP1 is on the map, and the people in this network are really exceptional within this space. So now, the next time a SYNGAP parent goes in to see someone who may not have seen a SYNGAPian, even though they haven't seen a SYNGAPian, because they're part of the RDCRN, the DSC, they're going to understand our patients and be able to help our families more. So it's really worthwhile. And in fact, what we've talked to BCH about doing is giving some grants to them and to people in the network to beef up their knowledge of SYNGAP1, right? So right now, if you said, Mike, I need an expert, I want to participate, I would say, you got to go to a Promise site. You got to go to Stanford. You got to go to CHOP. You got to go to Colorado Children's. And I would be right. Those are amazing sites. They have established programs for SYNGAP1. But we can't get every patient in the country to them. And now that with the DSC, we will have more options. I still argue everybody should go to Promise, but getting all these other sites to start thinking about SYNGAP and working on their existing SYNGAP patients is a huge deal. We should be really grateful to Dr. Sahin and really excited about this. Anyway, look at that post on LinkedIn. If you want to see all the consortia, there's an RDCRN link there too. I want to really give a shout out to SRF. Getting these grants is hard. I want to be clear. Getting these grants is hard. And BCH, Boston Children's, came to us a few years ago and said, hey, we think we can apply and get SYNGAP into the next DSC RDCRN. This was years with an S, like 3 or 4 years ago. And I was like, all right, how would we do that? They're like, well, you need to give us a big grant. I was like, And then we're going to collect a bunch of data and we're going to use that data in our application to show that this is doable, blah, blah, blah. And I was like, okay, let's do it. But then they sent me the grant proposal and it was for $300,000. $300,000. That was a lot of money for SRF a few years ago. Frankly, it still is a lot of money for SRF. And I was like, gulp, but we did it. We did it because we knew we were dealing with Dr. Paduri and Dr. Sahin and Dr. Levine, and these guys are the best and the brightest. And we wanted to improve the future for our kids, right? So that grant was given a few years ago, and that seeded this opportunity to be in the DSC. So good job, SRF. Good job for our longtime donors. Just to demonstrate for you guys, we think hard about the grants we give, the work we do, and we try to do it in such a way that it leads to more better stuff over time. And that is exactly what happened here. So this is a win, and we should celebrate it. And it's going to result in more papers about SYNGAP1, and that matters because when you go to PubMed, which is my next link in the show notes, you can see how many papers there are about SYNGAP year on year. And right now, that graph is climbing. It was 54 last year, and it was 42 in 2023. So now this year, so far, we are at 44, which means we have 2 more papers than we had in 2023, 10 less papers than we had in 2024. Why am I so obsessed with this chart? Because, papers don't cure kids, but they sure help companies and researchers decide to keep working on SYNGAP when they see that they see there's an uptick, they see it's interesting, and they see there's a lot of good science out there. The most recent paper on SYNGAP1, at least that I'm aware of right now, is this paper in Cell by Dr. Boaz Levy and Megan Quinlan and others, who I mentioned in the LinkedIn post, which is in the show notes. Click on that. Really exciting work about an AAV in mice. So just a reminder, there's ASOs, which are very precise small molecules that will be delivered intrathecally, meaning IT, meaning spinal, and go up to the brain and help the good copy work harder or whatever, and make more SYNGAP. But as they work, like most drugs and small molecules, they are consumed, and then 3 months, 4 months, however many months later, you got to go back and do it again. So you're talking about 2 or 3 spinal taps a year. And frankly, sign me up. Sign me up. Like, I want us to get these drugs done. Let's not even think too hard about this IT thing. It is the safest, cleanest, most direct way to get the drug to the brain. The other kind of medicine is an AAV, and this can be delivered intrathecally, ICM, other ways. I don't want to get into that right now. But the difference between a gene therapy and an ASO is that a gene therapy is one and done, right? It gets in the AAV, the V is a virus, so the virus replicates and it spreads, and that's it. And because we have an immune system, the next time your body sees that virus, it may not accept it. People are working on changing this, whatever. Anyway, AAVs, very exciting medicine. And we're going to have them soon, as these mice and other efforts show us. But I think for the first disease-modifying therapy, I'm kind of glad Camp 4 is racing ahead, because what I want to see first is just a naked ASO, no extra fancy science wrapped around it, just the drug in the needle, in the brain. Let's see it work. Let's show our kids are modifiable and be clear on what happens when they're modified. And then, let's go to the AAVs and just one and done. So super exciting. And frankly, after that, people are going to get an AAV and then they're going to want an ASO top up. It's going to get crazy fast, guys. But this paper showing AAV working in mice is really exciting, and I really want to compliment the team. I got to keep going. Last week we had a conference in Nashville, or not we, Combined Brain. I'm on the board of Combined Brain, so I say we. But Combined Brain had a conference in Nashville, and I wasn't able to go because it's too much travel. But Catherine and Vicky from our leadership were there. Catherine is our CSO. Vicky Arteaga leads LATAM. Catherine spoke. Vicky met with Terry Jo Bichelle, the founder and leader of Combined Brain. It was just great. It was a great conference. I heard so many good reports from everybody. Catherine gave a great talk. And what you need to know as SYNGAP parents is that our patients and our community were really well represented before a group of serious leaders in this space. Right? The Combined Brain really has people who are no nonsense. And it was great. And then Melissa Smith came. She lived in Nashville, and she wrote a post about it. And when she was coming back from her day, she wrote me, she's like, wow, I met so many patient advocacy group leaders, and I heard Catherine speak, and we are doing so well, and I was so proud to be part of SRF. So thank you, Melissa. Your comments were much appreciated. So look at her post on LinkedIn, look at Catherine's post on LinkedIn, and then just a personal reflection. We had a staff meeting the other day, and I said, Catherine, how you doing? She said, everything's good. Life is good. It's very exciting work. She said, but the hardest part is I barely see Joey right now because I'm traveling so much, and he's in a group home, and between my travel and him being in a home, I don't really have a chance to see my son that much. And I said, the irony there kind of broke my heart, right? She's sitting here working herself so hard on behalf of the fund and all our patients, and as a result, she's barely seeing her own son. It sort of breaks my heart. There's 2 events coming up, guys. October 4th, Scramble for SYNGAP, South Carolina. Julie Miles is killing it down there. Go to that event in Greer, South Carolina. Support SRF, raise money. We need the money. Our conference is in Atlanta, December 4th and 5th. You need to be there. You need to meet other SYNGAP parents. Bring your kid, don't bring your kid, up to you. It's going to be an amazing event. Links in the show notes. If you have questions, email us, info@curesyngap1.org. Social media, guys, follow us on LinkedIn and YouTube. Those followers matter. The reposts matter. The comments matter. It brings up our content, so when the next family gets diagnosed and types SYNGAP1 into search, they find the fund. That's what matters. Camp 4, by the way, closed at $3 the other day. Pretty exciting. Thanks for listening. I've kept this to 10 minutes. So you guys stop making fun of me about that. It's going to be great. I'll see you guys next week. I'll see you at the conference. Bye.